Today I will propose the creation of the Family and Mental Health Centre. According to the Ontario Incident Study for Canadian Child Welfare Research, over half of the substantiated cases are related to mental health and a lack of social support. In the current system, parents who are in crisis or who have severe or complex mental health challenges receive intervention by children's aid societies, and often this results in either the apprehension of their children or involvement with the kinship care program. The result is the separation of parents and children, resulting in trauma which impacts both the mental health of children and parents. The Family Mental Health Centre aims to provide a safe, comfortable space for the family to receive mental health treatment while remaining together. The ultimate goal of the Family Mental Health Centre would be the development of a dedicated building where parents can attend an early years center staffed by early childhood educators, early interventionists, and social workers where they can discuss the daily stressors and difficulties they face. This building will also house the CPU, Child Parents Unit. The 24-hour childcare will be held on the same floor as the Parental Mental Health Unit, where parents can receive mental health treatment while their children are nearby, maintaining the attachment between parent and child and providing mental health treatment to the entire family. The Family Mental Health Centre will work with several organizations in order to become sustainable. Through the employment of healthcare providers, funding will be received through OHIP for services rendered. The Family Mental Health Centre will house a donation box whose donations will be resold by the Early Years Centre to create steady revenue and help provide families with access to affordable children's and maternity clothing, toys, books, and toiletries. Initially, the Family Mental Health Centre will be piloted through a partnership with CAMH to have rooms allocated for families and through the creation of a childcare centre within the building. The childcare will be a fee-for-service program and will be staffed by a combination of early childhood educators, placement students, and volunteers. The childcare will also provide childcare services to families who have appointments at CAMH or need respite for a fee which will generate revenue. The Family Mental Health Centre will also partner with CAS and will be requesting funding from CAS for childcare for families who are low income, which will align with their mandate to keep families together, which will be a source of social revenue. The hope would also be to partner with these organizations on their campaigns to raise funds, as well as CAMH's One Brave Night and Bell Let's Talk. I will attempt to find an equity-seeking building or secure Section 37 funding to facilitate a social procurement to establish a dedicated building which will house the Early Years Center, the thrift store, the childcare, and the BPU. The center will be considered a hub for family mental health, providing psychosocial support, referrals, or mental health intervention. The Family Mental Health Centre will disrupt the medical model of mental health treatment for families, the separation of families, and the rhetoric that families with mental health concerns are unable to parent. It will challenge the disproportionate involvement of CAS in families with mental health difficulties. The Family Mental Health Centre will aim to provide a safe, comfortable place for families to receive mental health support sooner than current access time, as well as working with several agencies to provide mental health treatment that keeps families together and reduces CAS involvement and consequences from poor family mental health, such as childhood maltreatment, abuse, and neglect. These will be assessed by examining if apprehension and CAS involvement rates decrease over time, rates of emergency room visits by parents with mental health concerns, and surveys done with parents assessing their subjective experience accessing support.